This is One on One. We are thrilled once again to be joined by Christine Norbut Beyer, who is Commissioner of New Jersey Department of Children and Families. Good to see you, Commissioner.
Yeah, thank you. Nice to be here.
This subject, right? There's research about this. There's a report coming out. There's some private funding from a couple of foundations, the Burke Foundation and the Nicholson Foundation, $2 million of seed money to be involved in this.
Yeah.
Why are these horrific experiences for children so important to all of us?
I was going to say it's important because it's not specific to any one group. When we think about child abuse and adversity, that happens in childhood, lots of times it's easier to think it's happening to someone else or it happens to, those people over there, when in reality what the study showed, the ACEs study, is that adversity in childhood really is very prevalent, and it touches everybody. I think the original study said 67% of individuals have at least one adversity in their childhood.
By the way, when the Commissioner refers to ACEs, that is in fact Adverse Childhood Experiences. This is a study about this. And by the way, for those, it's interesting, you were with us the first time on State of Affairs. You talked about your department, and part of what is going on is trying to educate the public as to who you are, what you do, and why it matters. How has that evolved over the last, say, 6 months?
Yeah, well, I think, it continues to evolve, and there's a lot of work that we've been doing, that I've been doing out meeting with families, meeting with constituents. I've started a listening tour. And so really having the opportunity to listen directly to the families that we serve every day, the youth that we serve who, receive our services or, live in some of the programs that we fund throughout the state. I've been in getting to hear from them. It really has been eye-opening, and while the services I think are really helpful for those families, what I'm finding is it's not enough. There's not enough.
What are they looking for from the department?
I think...
Or from government overall?
I think most times when people think about the work that we do in our department, they do think child abuse and neglect, and so it's about...
It's a big piece of it, but not the totality of it.
That's right, and that's some of what we talked about, and so, my opportunity now to hear from families has really been about that they're struggling financially, that, I think you have had on other shows about childcare.
That's right. That's part of our, Commissioner, great segue.
Yeah.
The Right from the Start NJ initiative, you'll see it up right there, Birth to 3.
Yeah.
And you and Carol Johnson, other members of the administration, we talked to the Commissioner of Health today as well, Dr. Alton Hall, several agencies, several departments in state government responsible for children in one way or another, right?
Absolutely, yeah. And the Department of Education, I would say, that we partner together, probably 4 or 5 departments, pretty significantly on some really serious issues that impact children and families.
And that includes this ACEs issue. It's interesting, it doesn't fall simply into your department.
No, I think that, we work to prevent ACEs. We work to prevent child abuse through prevention initiatives and prevention efforts. But yeah, it's not. I mean, it's a health crisis, toxic stress, how that impacts children. It impacts their ability to learn. And so the work that we then do with the Department of Education and our other partners in the community, it's a public health crisis. And so it's not one department is, not going to solve this.
We were talking to the First Lady about this issue as well, and she seems extremely engaged and interested. There are several members of the administration here tonight. Why is a night like this, where folks from the private sector are together, foundations, corporations, and leaders in government like yourself and the First Lady here, what do you expect out of a night like this?
Well, I think it raises awareness that it's not, it's not just a government issue, that it's really public-private partnership. And, that's the way I think that we do some of our best work, and that's how we're going to get the best results for the residents of our state. And, we're going to improve outcomes for children is through public-private partnership. And some of the, the best things that I've been involved with in the past, both in New Jersey and working nationally, was when public and private comes together.
So when it comes to ACEs, adverse childhood situations, adverse childhood experiences, if you will. Do you see this, Commissioner, as, I don't want to overstate it, a national epidemic?
I don't know that
Is
it's
it a crisis?
Do you know what? It's a significant issue that needs to be addressed. I think there's a moral imperative around addressing ACEs.
I mean, for all of us.
For across the country.
Someone says,
yeah.
that's not my kid, that's not good enough.
Do you know what? Because it impacts every child. It's not just kids who are involved with protective services. There are majority of families where children are living in adversity every day, they're living with toxic stress every day, that never rise to the attention or the level of our department. And I think that's what's so powerful about this, is that it's not those people over there, it's us in this room.
Well, if 67%
have at least one childhood, adversity in childhood.
the majority have.
Yeah, that's right.
And there's a lot of it before because I know there are a whole range of other things going on tonight, including the event. We want to be sensitive to the Commissioner's time. What I'm curious about is you try to prevent is one thing, but then to deal with, to treat, to help, it's the other part of it, right?
Absolutely. I think we were having a conversation earlier today with Dr. Burke Harris, and she was saying it's kind of a chicken and the egg situation.
Who wrote a very compelling book on this subject.
Oh,
right?
fantastic. Yeah. I mean, hearing her speak about this, can really, I think, convert a lot of people to why this topic is so important. But it really is kind of a chicken and the egg thing where we need to try and prevent ACEs, but then we also need to treat them. And it's kind of like what comes first. If we don't help individuals as children have their ACEs mitigated, or someone step in to try and help them resolve issues, and they grow up to be adults that then have
Are they more
health
likely
issues, and then the cycle can repeat.
of adverse childhood experiences?
Yeah.
The cycle continues.
Yeah.
Commissioner, I want to thank you for joining us. And
Thank you.
Like you said, it's interesting. There are many departments, many members of the cabinet,
Absolutely.
the governor's cabinet dealing with this issue, and we appreciate you joining us again.
Yeah, thank you so much.
You got it.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the Turrell Fund, supporting Right from the Start NJ, the Robert Wood Johnson Foundation, PNC Bank, RWJ Barnabas Health, New Jersey Sharing Network, the Healthcare Foundation of New Jersey, and by Guarini Institute for Government and Leadership at St. Peter's University. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.